Welcome back. This is Professor David Bishai with the fourth and final section of our lecture, Pump Handle from Hell, How the Nightmare on Broad Street Still Stalks the Earth. And in this section we're going to summarize and weave together the various strands that we've begun in this lecture. As you'll recall, we began with the case of the Broad Street pump, which illustrates the dual nature of public health problems as both, in one way, simple, but in a more complex way, they are wicked problems that won't stay solved. We reviewed the essential public health functions and how they require public health workers, especially public health departments, to ensure that they have a data gathering expertise in monitoring the health of the population and doing outbreak control. But in the next phase, it's much more important to share that data about the health threats in a community with the community in order to have a collaborative approach to problem identification and forming solutions under the auspices of both technical experts as well as politicians as well as local community members. We established in part 3 that these approaches are very relevant to the modern public health burdens of chronic diseases and injuries, and how the need to change social, physical, and economic environments is going to definitely require an approach that engages the community. So in this section, I want to introduce the term collective impact. Now, this is a somewhat new approach to discussing what is a very old way of engaging communities. And this sort of came to our attention in 2011 in an article by Kania, K-A-N-I-A, and Kramer, K-R-A-M-E-R, entitled Collective Impact. In their article, Kania and Kramer described an approach that they had had experience with where 5 elements are essential to engaging stakeholders in a community. The first element is the establishment of a common agenda, which should inspire the second element, a shared measurement system to track progress on that common agenda. Those stakeholders are going to then set out activities that are mutually reinforcing, and they're going to stay in continuous communication. And the fifth element is the backbone support, which makes all of the prior 4 possible. This would be a secretariat or some leader that has volunteered or stepped forward to keep the stakeholders together to achieve collective impact. By staying on target, multiple stakeholders might find a way to get more coherence and coordination of their activities, and they might identify local assets that could be mobilized and combined with members of the community. Now, historically, it's been optional to invite the health department, even in collective impact formations that have been explicitly about health. It's true that many of these collective impact initiatives have been mostly philanthropists, mostly people who feel that they have a role in solving and doing, but they've also, as philanthropists, given up on local government. And so it's troubling that this movement might go forward as an independent parallel stream to solve community problems that does not involve the public health department. And one reason philanthropists might feel that there's no common ground is that so many health departments have their budgets tied to program funding. And more concerning, that so many health departments are really looking for quick wins and simple fixes, looking for the pump handles that they can immediately address to show that they've been effective. Now, community organizations are always integral to any approach to collective impact, and one gets concerned that the philanthropist might make a mistake of involving leaders and doers, whereas they might leave out common people. The way it's framed on the slide is the difference between doing it with the people versus doing it to the people. We saw in our one case study in this lecture on Chadwick illustrated the importance of having neo-patricians that make common cause with community groups, and that's how the community groups get empowered. That's basically how power happens. Now, in many community participatory groups, this isn't easy. There are obstacles. There's a remembrance of past grievances, and there's basically a lack of trust that will take time to overcome. So it's not going to be easy going. This is no birthday party for anybody. But it can be done, and the individuals working with collective impact are indeed trying to involve some members of the community. This diagram shows both a combination of what will happen in a collective impact initiative as well as what might be observable to a researcher. The gray box at the top of the diagram shows that there are three phases. There are early years, middle years, and late years. And in the early years, one is gathering the stakeholders together to find the common agenda and set forth different tasks and that coherent work plan. So that design and implementation is what consumes the early years. And one might find the existence of that shared measurement system arising in the early years. Later, in the middle years, one might be able to see some progress towards the shared measurement of outcomes, with some outcomes actually changing. And then in the late years, those objectives that have been set up in the collaborative impact would be observable and measurable, and one could finish with a summative evaluation. So how do we go forward? There's several exciting developments that give me cause for optimism. I want to mention the existence of the Public Health Accreditation Board of the USA. This is a national initiative to allow state and local health departments to voluntarily accredit themselves, and the initiative is built around those 10 essential public health functions. Those health departments that have undergone this process have all decided to evaluate their own performance of the 10 essential public health functions. And what they're finding typically is that one of the weakest areas for them is that community engagement. And if they notice that deficiency, one way for them to go forward would be to do something that either is collective impact or is going to look exactly like collective impact in engaging the community. And collective impact offers a set of tools that could be a blueprint for work in public health. So this is exciting. It's a way out of the nightmare. So let me wrap up by saying what we've talked about today. My first point was my observation that the public health community has had such a good experience with heroes like Jon Snow that we are somehow addicted to heroic narratives where they're simple versions of problem solving. We merely have to give the right chemicals to the right people, chemicals like vitamin A or vaccinations or oral rehydration solution, zinc and soap and water, and everything will be just great. I pointed out my perception that public health problems are wicked problems. They are indeed recurring nightmares that won't stay solved, nor are they likely to be close to being solved if their solvers are addicted to simple solutions. Public health problems are equilibrium problems. They are set up by powerful political and economic forces that enjoy the current equilibrium, and any way to reverse it is going to require some political movement that will require the community to be engaged. So although I'm worried that our public health workforce remains mired in the search for quick wins, and in a way our training it does not go far enough to improve our education in how to do community engagement, I think that there is cause for optimism. I think the Public Health Accreditation Board will reveal this weakness, and there are many new opportunities to reach out to other sectors, to hospitals, accountable care organizations, schools, and churches. And I think that the collective impact movement, which has made a lot of progress, is an architecture for community collaboration. So I believe that the next generation of public health scholars can take a good look at collective impact and advance implementation science as something that is something other than heroic, that isn't as romanticized, much more hard work, much more patience will be required, but in my opinion, this is the only way to go forward. So thanks for checking in on this lecture. I really hope you find it enjoyable and would like to continue the discussion.